Right. Well, welcome everyone to our Keen Caregivers Club. During this,
Thank you.
we usually do a little bit of conversation and then have like a relaxation thing. But tonight we're actually just going to have a conversation because I think that the information that we're going to talk about tonight is really important. And I know that a lot of our families are impacted by this and might have some questions. So I want to start off by saying that the information that I'm going to give you was presented to me by the Mayor's Office for People with Disabilities earlier today. They held a meeting for the information about the COVID-19 vaccine. So this is not information that, is really directly coming from Keen. This is just information that we're passing along from the meeting that we had today. So I just wanted to make sure that we say that. So I may not be able to answer all of your questions because I don't have that information. However, I should be receiving the slides and also the recording of the actual webinar itself that that was presented earlier. So we will be sending that out to all of the families. So tonight is really just for me to highlight the information that I heard. So I will do my best to answer any questions if I can, but I'm just going to be mostly speaking, and feel free to unmute if you have a question or share any, maybe you have information that, we don't have. I really want to make sure that, we're giving accurate information. So I'm just going to share what was presented today. So first, I want to just tell you a few of the people that were on the webinar earlier today, so you know where the information is coming from. The commissioner for the Mayor's Office of People with Disabilities, his name is Victor Khaleesi. He was on today, and Keen actually has a really good relationship with him. When Keen New York first started, he helped us a lot with getting into the New York City Parks and Recs department to launch our programs, especially at the East 54th Street Rec Center. So we're very familiar with him. And he also identifies as having a disability. So he is really a great advocate for this community. Another person that was on, his name was Jonathan Novick. I'm not sure exactly what his position is, but I know that he works in the office and does take some of their phone calls and communications. So he was on the call. And then there was the Assistant Commissioner of the Department of Mental Health, and her name was Dr. Olusimbo Ige, and she is a public health physician. And she was the one who did majority of the speaking and the presentation itself. So the presentation did open up with Mr. Khaleesi telling us that there are actually monthly community calls that are happening about the vaccine and the pandemic itself. So right now I'm going to put a link in the chat box and a phone number. So if any of you are interested in participating in these monthly community calls, you will be able to do so. Give me 1 second. Paste this in here. There we go. I saw that there was a question about sharing the presentation. So the office is going to be emailing me the information, and then I will be passing it on to you guys. Did not send it just yet. So I'm just basing what I'm telling you tonight off of the information that I got earlier. Sorry for the background noise, guys. That's my kids, as you know. So the phone number that's in there, in case you can't see the chat box, is 212-788-2856. And that is so that you can register for the monthly community calls that are being held by the mayor's office about the vaccines and the process and everything that's kind of relating to the pandemic in New York City. There's also a link there. That link should take you directly to register. And I will again send all of this out after this session as well. Next piece of important information that the commissioner shared with us is that all of the city sites that are offering the vaccine are being held in physically accessible locations, meaning there should not be any stairs or any difficulties. If there are stairs, there should also be an elevator. Everything is supposed to be in accessible medical facilities as well as accessible school sites. Now, those are for the city-based locations. There are some non-city sites, and the mayor's office is providing guidance regarding physical access, and they're also giving training to those non-city sites that have staff. They're giving training to that staff on how to work with individuals with disabilities. So they are really, making efforts to be inclusive. They are also working with different agencies about digital access as far as being able to get people information online and making sure that those websites and all of those links are accessible. So that comes straight from Smith BC. The purpose of the meeting, sorry, was someone saying something? Oh, no, okay. The purpose of the meeting was to provide the latest information, and they did have a pretty significant Q&A session regarding access and inclusion, and I did take down some of the answers to the questions that were provided, so I'll be sharing that here as well. The biggest question that a lot of people have had is about their eligibility for getting the vaccine now. And I will talk more about the categories of people that are currently eligible. However, if you do not fall into one of these eligibility categories, or your child does not fall into one of these categories, and you would like to advocate for getting a group of people eligible, the mayor's office says that that needs to go directly to the governor's office, so Governor Cuomo, because the eligibility rules are being made at a federal and state level. So the New York City mayor's office does not have control over the groups of people that are eligible. So I am now going to post a phone number and the website with the contact form. So if you would like to advocate for a different group of people to be eligible for getting the vaccine, they strongly encourage you to write to the governor. So I'm going to post that in the box now. So there was a question regarding if that presentation was recorded. The presentation earlier was recorded, and as soon as I get it, I will forward it to everyone. So let me paste this. So the information I just pasted into the chat is a phone number that you can reach the governor's office at. It also includes the website that has the contact form for the governor. And then it also has the address if you want to write a letter and physically mail a letter to the governor's office. Again, you don't have to copy all of this down. I will send everything in an email, but if you want to have it now, then you can copy it from the chat box. And then finally, the last piece of contact information that they gave us, two things actually. They gave us the phone number to the CDC. So if you want to advocate to the CDC or contact the CDC directly, I'm going to put that information in, as well as the Office for People with Disabilities, Mayor's Office. I'm going to put in all of their information as well. So they are posting information regularly their website, and if you have questions, you can call them directly. They also offer ASL video for anyone who's deaf or hard of hearing. So I'm going to go ahead and post all of this information into the chat box now.
I trust them. You can too.
All right, so let's see. I think we have a lot of, okay, there we go. Let's see. So the next thing was Dr. Ige. Like I said, she's a public health physician and she's the assistant commissioner for the Department of Mental Health. She provided a presentation and spoke to all of the things that I'm going to say next. Again, this is all coming from her and the Department of Mental Health. This is not, coming from Keen or my own personal knowledge. I'm only presenting to you what was presented to me. So they want everyone to know that the vaccine is free to everyone. So there should be no cost to you whatsoever when you are eligible for the vaccine. You should not be charged to get it. The vaccine is also available to anyone, regardless of their immigration status. So you do not have to have any proof of your citizenship or your immigration status. You should be able to get it regardless of immigration status. Also, your privacy is protected. It's basically follows like the HIPAA laws. So your privacy should be protected when you get the vaccine. There are currently 2 vaccines that have been approved by the FDA. There are the Pfizer vaccine and the Moderna vaccine. She really emphasized that people had concerns that the vaccine came out very quickly, and because of that they have concerns about the effectiveness, and she wanted people to know that the vaccine did go through many different trials, and based on those trials it has been proven 94% effective. So meaning that 94% protection, 94% effective. She really insisted that it is a safe vaccine to take and that it has gone through many trials. Another concern that people have expressed, and I'm sorry if I'm not answering questions right away. I see your question. If vaccine is free, why is insurance information collected on the spot? So my understanding is that based on what I heard, if you have insurance, then your insurance is being charged. But I believe that you are supposed to be able to get the vaccine if you are eligible, even if you don't have insurance. And I will talk about what the eligibility criteria are. I'm actually reading notes, so I can't see all the questions, but I will get to the questions. Definitely keep putting them in the chat box. I will answer any questions at the end. And Rachel, if there's anything important, you can stop me because I can't see the chat while I'm looking at the notes.
There is a question about if people with Down syndrome are eligible right now.
Okay, so I'm gonna get to what they
Okay.
said, the eligibility. So yeah, I'll get to that in just a second. Thank you for the question.
And just to interject, I was eligible for the vaccine, so I've already received it. But however, when they asked about the insurance information, because I see that's a question here, I didn't have it on me at the time, so I actually just clicked I don't have insurance, and it wasn't a problem. So
Yeah, you
from my
should
I
be
personal
know
able.
experience,
the
you
question is,
probably just say you don't have it if
I
you're more
did, I
comfortable with
did,
that.
I did my card. I did vaccination, and they asked me, and I understand it's free. And now I'm looking forward to see if the insurance company will charge me because I have high deductibles plan, and
Mhm.
it's
Yeah,
supposed to
you
be
shouldn't
free.
get any charge for the vaccine.
It's low. And when I ask about Down syndrome, Amanda knows that my son has different kind of disability. But as I'm just, I just curious because you listen to their presentation and why is it different criteria in different states? I was surprised in the state of New Jersey, people with Down syndrome staying number 1 in whole list of all kind of people who can get vaccination now, if it's not by age. And Down syndrome is staying number 1. And why is the city in the state of New York they are not eligible? I mean, it's not concerned me personal, but I'm surprised because this is supposed to be medical issue. It cannot be the people with Down syndrome in state of New Jersey have different medical issues than in state of New York. So
Yeah, so again, I'm only able to tell you,
I understand it's more
oh,
editorial
yeah,
question.
what they
It's
told
more
me, but
editorial
I
question.
will get to the eligibility because that is the next section. So I definitely will get to that question. I'm just going to jump back a little bit before I get into that, just to share everything that was shared with me. So just regarding the vaccine itself, another question that continued to come up is, can you get COVID from the vaccine? And again, Dr. Ige says that you can't get COVID from the vaccine. There are some side effects that people have experienced from the vaccine, and I will talk again about those in just a few minutes. But, you know, she said, and the scientists that put these vaccines together, they were not starting from scratch. I think a lot of people believed that, you know, this was obviously a new kind of disease. And so they thought, you know, oh, the researchers are just now studying it. But apparently they based a lot of their research off of past work that they've done. And so she, again, just emphasized that the vaccine is safe and 94% effective. Now, there was another question about if you have had COVID, should you get the vaccine anyway? Doctor said yes, that you should get even if you have had COVID before, because it can help to prevent reinfection. So, you know, apparently it is possible to get COVID again after a certain amount of time. So they said if you have had COVID within the last 90 days, you probably do not need to get vaccinated right away because they've seen that people who have had it in 90 days or so are less likely to get it again. If it has been more than 90 days, then it's a good idea to get the vaccine if you are eligible because it will help to prevent reinfection. If you currently have COVID, then they are saying that you should wait until the quarantine period, which is 14 days. You should wait until the quarantine period is over before you go to get the vaccine. There are some medical conditions that they are saying cause greater impact of COVID on people. So people who have heart disease, COPD, diabetes, obesity, any kind of respiratory issues do seem to be affected more by COVID. And so they are saying that if you have these underlying medical conditions and fall into one of the eligible categories, then you should vaccine, you know, if you're able to. Another question was about allergies. The doctor said if you typically have allergies, you should still get vaccinated, that the vaccine doesn't have a lot of the typical allergens. I think she said, you know, there aren't like eggs or things that people are typically allergic to. However, she said if you have had reactions, bad reactions to other vaccines, then you should definitely talk to your healthcare provider before you get the vaccine. So if you've taken the flu shot or you've gotten any vaccinations and you've had a bad reaction or an allergic reaction, then you should talk to your doctor before you get the. Now we'll move into the eligibility. So January 11th, these are the people that are eligible for getting the vaccine. And I'm actually going to put in a link in the chat box. It's nyc.gov/COVID vaccine distribution. And this is the link where you can find out the different groups that are eligible. So let me put that in here. Okay. So that's the link you can use to find out how the vaccine is being distributed and who is eligible. So right now, any at-risk healthcare workers, so anyone who is, you know, doctors, nurses, home health aides, anyone who's considered a healthcare worker that is working with the public and in high-risk situations is eligible to get the vaccine. Anyone who is age 65 or older is also eligible. Residents and staff that are in nursing homes or in any congregated group living situation. So meaning even if it's not a nursing home, but you have a child who's in a group living situation, residential home, they are now eligible for the vaccine. Frontline workers are also eligible for getting the vaccine. Right now, my understanding is that anyone that is outside of one of is not currently eligible to get the vaccine. There are 5 steps that the doctor gave us to kind of what the process is to get the vaccine. Is to check eligibility. You don't want to go to a doctor or, go out of your way to get a vaccine just to find out that you're not eligible. So you want to check the eligibility. And again, you can go on the website to see when you are eligible and what groups are currently receiving the vaccine. The second thing is that you want to schedule an appointment. So I'm going to put the link into the chat box as well as a phone number where you can schedule an appointment. So I'm going to put it in now. The link is vaccinefinder.nyc.gov and the phone number is 877-829-4692. So let me put that in now. Okay, and you have to have an appointment in order to get the vaccine. You cannot just go to a doctor or a pharmacy without, scheduling an appointment. The next thing is, and this is helpful if you're able to do this before you get to your appointment. So this is after you've scheduled an appointment, but before you get to it, there is a New York City vaccine form. It's basically an attestation form that you need to fill out. If for some reason you are not able to fill out the form online, then you can go and fill the form out on site. So this was really helpful for people who do not have an email address or are not very tech savvy. The form does ask you for an email, and that's one of the required fields online. So if you don't have an email address for some reason, then you can actually just go to your appointment, and they suggest getting there a little bit earlier. They will have this form on site. However, everyone will need to fill out the form. So I'm going to send you the form now, link for the form. It's vaccineform.health.ny.gov. So let me send this over to you now. And this needs to be filled out again before you can get the vaccine. So after you've scheduled an appointment, before you get the vaccine. Next is at your appointment, you have to have proof of eligibility. This means that you need to have proof that you are either a healthcare worker, that you are 65 or older, that you are a resident or a staff person in a nursing home or a congregated living situation, or that you are a frontline worker. You have to have proof. Some of the proof that they said is acceptable can be a letter from your employer. If you have the, an address of where you live in the nursing home, having that also works. Any kind of ID that shows that you work in a hospital. Obviously, your ID showing your age or your birth certificate, anything that you can bring in that shows that you are part of one of the eligible groups, you will have to present to get the vaccine. As of Monday, I believe she said, you now also need to prove that you are a New York City resident. So in order to prove your residency, you can have your ID. I believe she said either like your driver's license or your state ID. You need to be able to prove that you are a resident of New York City. And of course, you need to be able to wear your face mask in order to get the vaccine. She said that people have been turned away if they are not wearing a face mask. So you'll want to wear your mask. The last step is to make an appointment for your second dose. So there are 2 doses to the vaccine. And after you've gotten your first dose, you need to make an appointment for your second dose. Now, she said that the sites are supposed to now be asking people to schedule before they leave to make their second appointment. However, some places are still not doing that. So you may need to go back onto the website to schedule an appointment online to get your second dose, or calling the number that I listed before to get your second dose. Now getting in, that's kind of like the basic information. So now getting into some of the harder things. There
I'm sorry.
are no, I'm sorry, did someone have a question?
Quick question. This what you are telling, it's only about city sites, or it's rules in the city of New York?
So this is the rules for New York City.
Yeah, the rules are for New York City. Why I try to figure out. This is the rules for the places where they're doing vaccination because city of New York established this site, or it's the rules in the city of New York?
So no, this,
I will explain you. It's a very practical question. You told about that it's supposed to be for Monday proof that it's a New York City resident. But we
yes,
have many people who are New Jersey resident. People
right.
are
They
working
cannot come,
as
they
a
cannot come
caregiver
here.
for Paul, so they cannot do it in the city of New York.
Correct. They cannot do it in a different city. You have to do it where. So they're saying if you're going to go to one of the New York City sites, then you have to be a New York City resident. So you can't be from Westchester or New Jersey. They are looking for all of the New York City sites are going to ask you for proof of New York City. That's what she said. And she said that that was new. It started on Monday. And my understanding is that it's because it is, there's the shortage of vaccines. So they're trying to make sure that they're only giving vaccines to, people in New York City. They're not going to want people to fly in, travel in from other places because of the shortage. Which is actually what I say next is the doctor said there are currently no appointments for your first dose. All of New York City is out of the vaccine for the first dose, and we have to wait until more doses become available. People who were scheduled to get their first vaccine dose this week in a city-run site, so this is for city-run locations, their appointments have now been rescheduled for exactly 1 week from your original date. Meaning if you had an appointment for Monday, then your appointment has automatically been rescheduled for next Monday. And again, that is for any site that is a city-run site. There are no more first doses of the vaccine. What she also said is that public eligibility, so meaning the vaccine for everyone, will likely not be available until the middle of the year. So she's thinking around the summer. Right now, they're going to continue with this slow distribution process for these eligible groups. She said that it probably will not be available for everyone until mid-2021. She also said that on the website, there is a place where you can subscribe to get updates and to be notified. I'm not sure if it was text or email, she didn't say, but she said you could subscribe for updates to be notified when appointments become available again. So right now, if you are trying to make an appointment, you will not get one. You can't get an appointment right now. She also said that every provider manages their own schedule and process. So there are some providers that may ask you for certain paperwork that won't be the same in another location. And there isn't like one schedule for all of the sites. The sites are managing their own schedules. So you'll want to make sure that you go onto the site and you look into, that you go onto the website and that you look into the location that you are planning to go to see their individual schedule and to understand what their requirements are for when you go to the site. As far as transportation, if you are 5 years old or older and you are not able to use public transportation and you are unable to get someone to take you to the appointment, there is free transportation available to and from your appointments if you are going to a site that is run by New York City. So it is only for the city-run site. So if it's a private site, then that won't qualify for getting this free transportation. However, if you are going to a city site and you are 65 or older, you can get free transportation. And she said that that information for accessing the free transportation will be available when you make your appointment. You will get the information for that. If you are deaf or hard of hearing and need support with transportation, she said to call 711 to get transportation support. Now I'm going to talk about the side effects that she discussed. Good night. Sorry, guys. I'm going to talk about the side effects that she discussed. She said that some of the side effects of the vaccine are swelling at the injection site, soreness in your arm, and redness around the injection site. She said some people are also experiencing a headache and a low-grade fever that can start 1 to 2 days after you've received the vaccine, and it typically lasts 1 to 2 days. These side effects are seen more often after the second dose. So most people don't get any side effects from the first dose, but after the second dose, some people are experiencing side effects. She also said that it is more common to experience these side effects if you are a younger adult. Now, she didn't say what the age was. She just said older adults are typically not experiencing side effects. Younger adults may experience side effects more than older adults. She also said it is still important, even if you get these mild side effects, for you to get your second dose. So if you have a side effect from the first dose, you should still get the second one. It's important that you do both. It's also important to note that the full 94% protection of the vaccine, you're not actually fully protected until 2 weeks after the second dose. And because of that, you should still continue to practice the prevention methods of social distancing, washing your hands, wearing a face mask, everything that we're doing now to protect ourselves, you should continue to do even after you have received the vaccine, especially because it's not fully effective until 2 weeks after you've received the second dose. Now they moved into the question and answer portion. So this information is based on questions that were asked in the community. Some of these were questions that I had. So I'm going to give you the answers to the questions. So someone asked how long the vaccine protection lasts. They wanted to know if it's like the flu shot, if you were going to need to get it every year. And unfortunately, the doctor said that they do not have an answer to this yet. They're not sure how long the protection lasts or if you are going to need to get the vaccine again. Right now, based on the trials that they've done, they said people have still been protected 4 or 5 months later, but they are not sure how long it is going to last. So this is still something that, is kind of up in the air. It is possible that you may need to get vaccinated again in the future. Again, she reiterated that eligibility for getting the vaccine is determined at the federal and state level. So if you want to advocate for a certain group to become part of the eligibility requirements or the eligibility criteria, then you should contact the governor's office. Someone asked if there is like a hierarchy of disability priority, meaning, are people with autism going to get it before people with physical disabilities or vice versa? She said there is currently no hierarchy of disability. It's not based on your disability right now or the type of disability, and underlying conditions are also not part of the criteria. Right now, if you are 25 years old and you don't have a disability, but you have a heart disease, you do not fall, and you don't, you're not a healthcare worker, you do not fall into the eligibility. So underlying conditions are not being considered as part of the criteria for eligibility right now. There are, sorry, I'm just reading my notes here. As far as the ages, so Pfizer has said that their vaccine can be given to people ages 16 and older, again, who fall into the eligibility, but the youngest is 16. Moderna is age 18 and older, unless you are in a congregant home. So if there is someone who is under the age of 18 that lives in a residential setting, they can receive the Moderna vaccine. However, Pfizer has said no one under the age of 16 can receive the Pfizer vaccine. So right now, children are not eligible. There is no information yet as to how the vaccine is going to affect children under that age. There are some people who are getting their second dose of the vaccine before new people get the first dose. So right now, they do still have some second doses available, but there are no more first doses of the vaccines right now, which is why those appointments that were scheduled for this week have been rescheduled to next week. They're anticipating getting more of the first dose hopefully soon, is what she said. Just going through my notes. So there were a lot of questions about people who have sensory issues or are otherwise unable to wear a mask for any reason. Because as I mentioned earlier, one of the things that all of the vaccine sites are asking is that people wear a face mask. Right now, if you go to get vaccinated without a face mask, you will be turned away. They will not give you the vaccine. So right now, if you are not able to wear a face mask, you cannot get the vaccine at one of the current sites. The doctor said that the plan is for people's primary care physicians to eventually be able to give the vaccines to people, but right now that's not an option. So you will not likely be able to get vaccinated at any of the current sites unless you are able to wear a face mask. The commissioner, Mr. Khaleesi, did come back on during this conversation and said that this is something that they are really talking about and advocating for, because this is something that has been an issue for many people since the start of the pandemic and since the start of us needing to wear masks, is that there are some people who are not able to. And this has been one of the advocacy things that they have been working on. So he wanted to let us know that, they are aware of it and it's something that they are, trying to work on and figure out a process for. Now, people who are residents in group living, so again, like nursing homes or any kind of group home setting, they do not need to go get the vaccine at a site. The vaccine will be brought to them. So doctors are going into the residential homes and giving those people the vaccines. So they are not going onto a site, they're getting it. They're getting it where they live. There was a question about languages other than English. So you are able to schedule an appointment in another language. I believe she said there were 182 languages that the phone line is able to handle. If you are able to schedule your appointment online, that is the best way to do it. People have said that the phone line, it takes a very long time. You're on hold for a very long time. So if you're able to do it online, that's the fastest way. But if you do need to speak to someone or you're not able to schedule your appointment online, then you can call, and there are other languages besides English available. There were questions about the second dose and, how soon after receiving the first dose do you need to get the second dose? People are seeing that they're getting the first dose and sometimes their second dose appointment is not scheduled until a month or close to 2 months later. So she gave a specific window for Moderna. She did not give a specific window for Pfizer, but she said for Moderna, the second dose needs to be within 28 to 48 days. So if you have an appointment that's 30 days later, it's still within the window of time, and that's okay. She did not give a specific window of time for Pfizer. So this is for the Moderna vaccine. And there was one final question that I was able to take note of, and this was about parents who are functioning as home health aides or home attendants for their children. And this question was like a little difficult to fully understand the answer to, but the doctor said that if you are a parent who is essentially caring for your child and doing the work that a home health aide would typically do, then you may be able to get the vaccine as a home health aide. And that ideally you would have some kind of letter or documentation saying that you provide this kind of care for the child, and so you would need to bring that letter with you. So, you know, she was not very clear. So my understanding is maybe if you get a letter from a doctor, she actually told the person who asked this that if the person who asked was a child who was blind and whose mother was caring for her. And she said, if you go with your mother to the site, they will likely give you the vaccine. So again, I don't know all of the details. I know we have a lot of caregivers obviously on this call. So if you would like more information about, you know, the right of the parent who's maybe acting as the home attendant, then I would encourage you to use one of the phone numbers that I put into the chat box to contact the mayor's office to see, you know, what criteria or what documentation you might need to have. So those were all the things that was all the information that I got. I know that it was a lot. So I will do my best to answer any questions. Rachel, did we get any questions?
I don't think we had a question about if the second dose was the same as the first one, I think, and from my understanding, it is. Oh, the first vaccine is identical to second dosage. I think it's just the second dose of the exact same thing.
Yeah, because this is my question is if we got as the first, and now it's a problem with this dosages. If the city calculated the amount of dosage which we have in order to somebody who got the first one to get the second one.
Oh, so to answer your question, I was able to schedule as a teacher, schedule an appointment for the first dose on January 11th. I somehow lucked out, and so I scheduled it, and then after they input in the computer that I'd received the first dose, I was able to go back online and schedule the second dose. It was interesting. It blocked out. I couldn't schedule it before a time that was 28 days from when I received the first one. Does that make sense? So it's from my understanding, my appointment is still there when I log in. So I think, I don't know, but I think if you got a first dose, I think they may have saved a second dose for you. If that answers your...
I'm so surprised. I understand that state from state are different. I'm like clearly understand, but I did never thought that it's so different. So different. My mom was able to get vaccine, and I went with her physically that she will get vaccine. But we went with her to New Jersey because we got a spot in New Jersey. And
yeah, so the residency, you know, the residency thing was new, and I don't know if it's just New York City that's doing it, but she said as of Monday, you now have to bring proof of residency. So I know they weren't doing it before.
Yeah,
but
that's
now,
what I don't know how other location will do it now. Maybe they will change it, but this is what you told that you register. When we did in New Jersey, they gave my mom right away card immediately, right away card when it's her next appointment. So she didn't do nothing about it. She's 82 years old. As soon as she did it, I was just helping her, you know, to do this. As soon as she did it, they present her card right away. This is your next appointment. This is the date. This is the time. Exactly the same place. I even asked them a question. Is it mean that we mandatory have to come to your place? They told yes. If you did the first vaccine here, you are coming for second right there. because we
Yes.
put it right
I mean,
away.
that would make more sense logically.
Yeah.
When I scheduled my second appointment, I could have picked any place that popped up on the list of places.
Yeah, that's why,
So,
you know, I'm
you
surprised
know,
that
every
from,
state is different. From my understanding, from the news, basically, Amanda might have different for the meeting, but it's pretty much up to every single state how they want to do it.
Yes. So the distribution rules are being regulated federally, but
Of who gets it,
yes, of who gets it, right? Distribution,
not how it's
but
actually
how
distributed.
it is distributed is being done on the state level. Again, who the people that we were getting this information from was the city level. So there are a lot of layers
yeah,
to,
yeah. I read it, all of this stuff, and my question was, is the first vaccine identical to second? Because I
yeah,
tried
I'm
to
not
find out
sure.
the answers, but I didn't see. I thought, like, you know, sometimes it's the first dosage, then the second, maybe it's like working together in combination. First dosage is something, second is some. I
Yeah,
don't
it's
know.
my
I'm just
understanding
speculating.
that,
I
from my
don't have.
understanding, my sister also works in a hospital, is that, I mean, someone else might have more information, but that it's just a second dose of the exact same thing, that it's more effective when you have 2 doses of the exact same thing.
Okay. And I
So
saw we did have another question. Someone was asking me to repeat about the residents in group homes being able to get theirs. So what the doctor who presented today told us was that people who are living in group homes or nursing homes, they will not need to go out to get the vaccine at one of the sites, that the vaccine is being brought into the residential homes and being given to the people there. So if you live in a nursing home or a group setting, then they're supposed to be getting it in the location where they are, having a doctor or someone come in to distribute the vaccines at the site. You should not have to go out to any of the sites to get it. That's what she said.
I have some information. It's also on the level of speculation, but I spoke with the people at Premier Clinic, you know, YAI Premier Clinic, and they told that they're trying to lobby that there will be a site for people with disability on their different location in the city of New York and state of New York. YAI is a big organization, to make sure that people with different kind of disability will be able to get vaccination there. So, you know, they are more trained how to deal with all of this agitation, with this issue to wear mask, not to wear mask. So they're trying to get a lobby either to do vaccination of our population in their facility, or maybe through a system of visiting nurse to do vaccination in the house. Visiting nurse is much more complicated because, you know, you open box with vaccine, you have to distribute immediately within certain hours.
Yeah,
You
so
know.
that's the problem with that, you know, someone did ask about having someone come to their home to do the vaccines, but because the vaccine has to be kept at a certain temperature and has to be used within a certain time once it's taken out of that temperature, right now it's too difficult for them to distribute it to people who can do it at home or even to primary care physicians. They're being so strict because, you know, the temperature of this vaccine is such a big deal. They have to keep it at a certain temperature to distribute. So
That's why when I spoke with YI, they told they hold some town meeting with different organization to make their side because they did for their employee. So they have experience, they have something where they can keep this vaccine for a certain amount of time to organize people with disability to do it on their premises because they can follow the protocol. I'm just telling you, it's still on the level of lobbying. They're still not deciding, but it's
yeah,
some kind of solution how to deal with these populations as they will not be put aside because it's not only about them, it's about all their families, the caregivers, like
yeah,
how to deal with this logistic of this problem.
yeah.
But
Um, yeah, no, I hear you. It's kind of a mess. They did acknowledge that it's kind of a mess. I saw we had another question. Someone said that the staff at a group home received the vaccine, but the residents have not. was anything further said about it. No, nothing else. So I don't have any information about like, specific process, or when, people, the residents are supposed to get it. That was just what was said based on a question that was asked. I'm not sure what that process is.
I have a question, Amanda. So,
Yeah.
did they say anything about the wait time at the city sites? Because the site I went to was, granted, it was the first day, it was apparently open. The one in the South Bronx, actually not that far from where Keene at St. Mary's is. It's, if anyone knows where the post office is around there, it's behind the post office or near the train tracks. Anyhow, the wait was incredibly long. They tell you don't come until 5 minutes before your appointment. So I did come 5 minutes before, but I waited in line for an hour in the cold.
They
So
did not
obviously,
say anything about like wait times, but like I said, right now there are no like appointments
right.
available. So you do have to make an appointment to even get the vaccine, but there are none available now. So definitely, like, no one should be going now because there are no first, I should
Right.
clarify.
No, no. What I meant was, did they address, because I know there've been criticism of that, like of people who had appointments. I had an appointment
Waited a long
that the
time.
wait time is still really long. And if that
Yeah,
was
no,
ease
that
up
that
or,
didn't that didn't come up.
okay.
I left about 15 minutes before it ended. It was like a 2-hour thing. So I left about 15 minutes before it ended. So I can, in the presentation, I can see if maybe that was asked before I left. But I didn't, no one had really addressed it. And I think, again, this was mostly for people with disabilities. And so I think that a lot of the people who are on like haven't even gotten to that point of being able,
Right.
not even
Because I know
eligible.
that would be another concern for people in general, but especially if you're waiting with someone who, or taking
Yeah,
someone,
for
or
sure.
someone is going who has difficulty waiting for any reason.
Yeah, no, that wasn't a question, but again, they did encourage, like, if you had questions or anything, definitely like reach out to the contacts, because those are all things I think are important and that needs to be out. So anything else?
I was just gonna say, because I had to find out whether I could take it 'cause I have asthma. I had a blood clot when I had him, but I did go on just to see like where the sites were, being a teacher. I live in Queens, and if anyone knows Queens, public transportation stinks around here. Like the places that I could go were nowhere near like trains. Like it would take me 2 hours on public transportation, you know?
When I was at the site in the South Bronx, there were people in front of me and behind me a line who were saying, oh, I came from Queens. They'd come from a lot of far off
Yeah.
places. But I think the city is working on opening new centers, because since then, did they open one at the Javits Center in Manhattan?
They did, and the Javits Center is currently out of doses as well.
Okay.
Yeah,
But they're still, my point is, I think maybe they said in the meeting, man, they're trying to open more locations, it seems.
Because
they
my kid gets access,
are.
I started thinking if I do go get it and he doesn't get it at the same time as me, if he does get it, I have to find out from his doctor. We could take access a ride, but am I allowed to bring somebody? And like, I'm sure a ride will leave us because we won't be done in time, and then I still have to get home from there. You know?
Yeah, so one of the questions was, about Accessoride and, if you needed to be like enrolled with Accessoride. They did talk about some other options like an ambulette service. They talked about basically they did talk about other options that you would basically be paying for. I know that the only thing they said as far as free transportation, it was not yet a discussion about free transportation for people with disabilities, except for the deaf or hard of hearing. That was the only disability that she addressed. The free transportation she specifically said was for people who were 65 and older. So I don't know, again, because we're not like a lot of people with disabilities are not even eligible right now. I think they don't have a lot of these answers even because they're so busy trying to just get it to the people who are eligible, and they probably can't even think about the hundreds of thousands of people who don't even fall into the eligibility category yet. But I do know that the mayor's office, like I said, Mr. Khaleesi and Jonathan, who works with him, they did say that they were doing advocacy for access, that they recognize, you know, accessibility and access is a big thing for the disability community. So I know that they're advocating for it. Now, what is going to come of that, I don't know, but these are definitely things, you know, the biggest thing I got out of the meeting was the contact information. So I really, really think that, you know, if you have questions or concerns, or, you know, you want to make sure that people are thinking about certain things, please use those numbers, use those email addresses, reach out. That's the only way. If this week taught us anything, right, that's the only way that change is going to happen, is if we are speaking out for that change. So definitely reach out. Any other questions? I know that we're a little bit over the time that we usually go today, but I did think that this was just really important. So if you do have other questions, you know, again, I'm sorry that I don't have answers. You know, I don't want to be part of the misinformation that I know is going around. So I don't want to answer questions that I don't have answers to. I don't want to, you know, speculate or give you wrong information. So, you know, again, all of this is coming from the presentation that was given today by the Mayor's Office for People with Disabilities. They are going to send out the presentation, which was some slides, and they are going to send a recording of the meeting as well, the webinar. And I will distribute that to all of the Keene families and volunteers. I'll actually just send it out in a big email. So yes, definitely begin to, you'll be able to see that information directly from them. It is long. It was about 2 hours. So if you want to listen to the whole thing, definitely cut out a 2-hour time period. A lot of it was the Q&A in the end. But I pretty much gave you the highlights of all of the important things that I was able to get from it. So, and thank you. Someone said my cat is very cute. So thank you.
Your cat always loves to make guest appearances.
She does. She does. She's
Sometimes the dog does too.
Well, thank you all so much for joining tonight. I hope that this information was helpful to you. If you want to reach out to me with any questions, you can always email me. Again, I probably will not have the answer, but I will do my best to get you to the person or website or whatever that does. We will have sessions for your kids tomorrow at 11 a.m. We will have our Keen Fit session. And then tomorrow afternoon, we will have art and games at 2:30. So you will all receive an email with a reminder with the link for those sessions. And we look forward to seeing you all. And then for the Caregivers Club, we will see you in 2 weeks. And we have some special things planned in February that you'll be getting information about for the Caregivers Club. Some really great presentations that we're going to have. We're bringing in some guest speakers. So definitely looking forward to seeing you guys in 2 weeks. So thank you so much and have a great night.
Amanda, if you have a chance, please include Paul for weekend.
Yes, I added you to our list. So I have you down. You'll get those links tomorrow morning.
Thank you, Amanda. Thank you.
All right.
Thank you, Rachel, for first-hand experience.
You're
No
welcome.
problem.
It's
Yes.
a
Thank
tough
you.
time.
Have a
It's a
good
tough.
night.
Good night.
Thank you.
Marina.
Good night.
See you
Bye.
tomorrow.